Hello friends, I am Gaurav, and has either of your eyes ever been operated on? Even if you haven't, just imagine that you are lying on a hospital bed and your surgery is underway. During this very surgery, you suddenly regain consciousness right there on the operating table, and you start to feel the medical instruments cutting into your body. Now don't forget, this is your own surgery happening right in front of your eyes. And now you can feel every bit of pain caused by that very operation. The truth is, incidents like these are even more common than you might think. The data we have actually shows that this could very well happen to anyone in the future. So make sure to watch this video all the way to the end, because today we're going to talk about some people who have already experienced this incident themselves and who can teach us what should be done to prevent such disasters in the future. So without wasting any time, let's get started. Generally, before any surgery, the patient is given an injection of anesthesia. This general anesthesia performs two functions in our body. During surgery, it makes the patient's body unconscious so that they don't feel any pain. And secondly, it prevents the creation of new memories. That means after the surgery, the patient's mind retains no memory of the surgery itself. Now, every year, more than 21 million surgeries are performed worldwide. But in some surgeries, for certain patients, it's as if their worst nightmare comes true. They experience a condition known as anesthesia awareness. Anesthesia awareness means that during a surgery or operation, a person regains consciousness and is able to feel pain just like any normal person would. But it doesn't stop there, because this is just where the real trouble begins. Due to the general anesthesia, their body is paralyzed. That means they can't move, and during the operation, they're unable to express their pain or consciousness to anyone else. They can even hear the sounds happening around them. They are aware of everything, but unfortunately, no one else can witness this. They remain conscious, but find themselves completely restrained. They feel like they are screaming, but the screaming is only happening in their mind, and their voice doesn't reach the doctor performing the surgery. They try very hard to move their arms and legs, but they are unable to do even that. Sometimes it also happens that the patient is already anxious and extremely tense even before the surgery. Now, this situation is the most painful for enduring this experience, because during the surgery, terrifying thoughts related to the operation keep running through the patient's mind, and they start to feel everything that is happening, something that isn't actually even being lost. The emotions of fear make us hypersensitive and hyper-aware. According to statistics, every year around 21 million surgeries are performed worldwide in which patients are given anesthesia. Out of every 1,000 surgeries, there are 1 or 2 cases where a situation of anesthesia awareness occurs. That means in total there are about 0 to 40 such cases every year. The chances of anesthesia awareness are higher in patients who are already dealing with multiple medical conditions. In 2004, a patient named Sydney Williams was about to undergo heart surgery, and the doctors had already informed him that his chances of surviving or dying during the surgery were 50-50. When the doctors were opening his sternum, that is his breastbone, he regained consciousness. He couldn't move, nor could he make any sound. He couldn't even cry out in pain, but he could clearly hear the conversations happening among the doctors. According to him, this experience was like an extremely terrifying nightmare. In an interview, he said that the fear was such that it felt as if he was being buried alive. After this operation, his life was saved, but it had a profound impact on his mind, and he lost sleep for many nights. This is called post-traumatic stress disorder, which is common in such cases. A similar incident came to light in which doctors had to perform surgery on a woman named Jeannie Smith to remove both of her ovaries. In the middle of this surgery, she regained consciousness and saw a bright light shining on her face. Due to the medications, Jeannie's body was paralyzed, and because of this, she was unable to speak or give any sign that would let the doctors know she was conscious. She could feel every cut and stitch, enduring all the pain that came with it. For her, the pain felt as if multiple bombs were exploding inside her body. She was panicking, and even though there was a breathing tube in her throat, she was struggling to breathe and felt as if she might die right in the middle of the operation. And this happened because the anesthetics being supplied to Jeannie's body during the operation ran out in the middle of the procedure. As a result, she regained consciousness and became the victim of a terrifying incident. But the most dangerous case of anesthesia awareness that has come to light happened to a man named Sherman Sizemore. Sherman Sizemore had abdominal pain, and to find out the cause of this pain, he was to undergo an exploratory surgery. The doctors gave him paralytic drugs, which would prevent him from moving at all because his muscles would be completely locked. But due to a simple mistake, he was not given any anesthesia, and the surgery was carried out just like that. For a full 29 minutes, he was conscious during the entire procedure and saw everything happening right before his eyes. However, he was completely unable to move even a little bit. 16 minutes after the surgery began, as soon as Sherman's abdomen was cut open, the anesthesiologist realized his mistake and immediately injected anesthesia into Sherman's body. But by then, it was already too late. After the surgery was completed, as soon as Sherman regained consciousness, he was in a terrible state due to fear. He remembered everything that had happened at the beginning of the surgery, and this terrifying experience was leaving a deep impact on his mind. For many days after the surgery, he couldn't sleep properly, and whenever he tried to sleep, he would have nightmares about the surgery, and sometimes he even felt as if people were burying him in the ground. He couldn't endure this anxiety for long, and within about a month of the surgery, he committed suicide. In most cases, anesthesia awareness occurs due to the negligence of the anesthesiologist, or when the doctor is unable to properly assess the patient's body's demand for anesthesia. Due to the advancements in medical science, there are now machines available that can read a patient's brain during surgery and inform doctors whether the patient is about to regain consciousness or not. However, because these machines are expensive, they are available in only 15 to 20% of hospitals. But if you ever need to undergo any surgery, there is absolutely no need to be afraid. You just need to take a few measures to prevent this situation. Before any surgery, the doctor asks the patient about their medical conditions to determine whether you are fit for the surgery or not and how much anesthetic your body will require. Just make sure that you tell your doctor everything truthfully and do not hide anything from them. By doing this, the chances of you experiencing anesthesia awareness are significantly reduced. Before the operation, also make sure your parents inform the doctors about this so that special care can be taken regarding this matter. And if for any reason you do experience anesthesia awareness due to the negligence of the doctors, you can also take legal action against that doctor. So friends, that's all for today's video.